Hello, everyone. I would like you to imagine what it's like to be a head of a household in rural Mexico. And by that, of course, I mean a woman, like Maria, who is the one that really has the responsibility of raising her children. When they were born, Maria started going to monthly health meetings organized by the health ministry. In one of those meetings, she heard that the water in her community had viruses, bacteria, and protozoa that caused disease. But her neighbors were skeptical. People in the community had been drinking that water for generations. But Maria knew firsthand, and she could see how her children had tummy aches and constant diarrhea. And she was worried that this would limit their chances to develop to their full potential. So she started boiling water. But collecting additional wood and then waiting for the boiled water to cool down was too much of a hassle. And she ended up reverting to drinking contaminated water. A few years later, a water purification company from a nearby city started delivering bottled water in her community. So she managed her budget and started purchasing the water. But in these communities, rough times come, and so she could not always secure safe drinking water for her children, and the tummy aches continue. In addition to this, the money that Maria spent, and some of her neighbors as well, on purchasing the bottled water, left the community to never come back, contributing to stagnating the local economy. So for these reasons, we have developed a social franchise model in which women entrepreneurs like Maria manage purification kiosks in their communities, offering safe water at an affordable price. Through the revenue generated of the sales of the water, Maria can cover her operating costs. She can pay us a service fee that allows us to provide an ongoing support, and she can earn a profit that gives her more freedom to make the decisions that improve the quality of life of her family. In our franchise model, we bring the sourcing and the purification of water to the community. With this, we cut the huge cost of transporting the water from urban areas, and allowing Maria to reduce the prices and reach many more families. We use technologies that meet strict international standards to guarantee the quality of the water. We work with women like Maria to better engage with customers, understanding their needs and identifying opportunities so that we can deliver better services. And we invest in entrepreneurial capacity building so that entrepreneurs like Maria can develop successful businesses that provide service over the time and contribute to the local economy. Maria is really proud to be one of our entrepreneurs. Think of it. She's tackling a problem better than the government and companies that have to try to provide safe water to these communities for decades. But Maria also understands that there are some challenges ahead. Her driver spends most of the day driving through the community, trying to find what's the next family that needs a water jug. So we're moving now from a retail-based model in which the water is sold on a unit-by-unit basis to a subscription service. This will allow Maria and her driver to plan the deliveries, further cutting the transportation costs and allowing them to reach many more families. What's more important than that is that the subscription model creates a constant revenue flow and also allows us to guarantee the consistent consumption of safe water, which strengthens the business and perfectly aligns with our impact model. Think of the opportunities that lay ahead for Maria. She's at the front of a distribution chain that reaches the doorsteps of a solid customer base. Through this, she can deliver key messages and products like hand sanitizer and soap that drive behavior and healthy habits in her community. So I told you the story of Maria and our work, and now I would like to move the spotlight to you. So imagine what it would be like to partner with us this year and now to invest in bringing IT to our operations and management, to enhance our subscription-based model, and to develop a product platform on top of it, while we replicate the story of Maria to 15 new communities in Mexico in the next year. And then taking a step even further, as we work with hundreds of women and empower them to become leaders in their households and change makers in their communities. All of this while developing a regional distribution network, creating healthy habits, and delivering safe water to hundreds of thousands of people. I think you can agree with me that by working together with entrepreneurs like Maria, we can shape a much brighter future for rural communities in Mexico. Gracias.